Students, in this module, we will talk about the process of social casework, and there are 6 phases and steps which we will discuss in the process of social casework. The first step is intake, which is called and said to be the first interview, in which a rapport is built with the client. The caseworker tries to build a rapport with the client because of having a healthy relationship with the client, and so the client can feel comfortable while describing his problems with the case worker. The second, briefly speaking, we will discuss about the second step in the process of social casework is psychosocial study, in which the matter is investigated through situational analysis of the problem of the client. And third one is the psychosocial diagnosis, in which the assessment is made about the factors which are responsible and which create cause for the problem for the client. In fourth step, we will discuss about the intervention, the treatment which is adopted for the solution of the problem in the problem-solving process for the client. And the fifth one is the monitoring and evaluation in the process of social casework. And sixth one is about the follow-up and termination. So we will discuss the first one, which is about the intake. And this is known as the first interview for developing good rapport with the client. The client is a person who comes to an agency for professional help through a caseworker. The client can be referred from the other agency to the relevant agency, or the client can come directly through the agency for seeking help, or the client can come through the social case worker for the solution of his problem. And in this step of rapport building, a good communication, a good relationship is established with the client and the caseworker through having a healthy interaction between these two people. And this is, it is known initially as a relationship between two persons of unequal position and power, because on first side, a caseworker who has a good professional knowledge and is familiar, acquainted with all the techniques and approaches and skills of the professional social casework, and on the other side, there is a person who is in problem and who is suffering from an issue. So this relationship is between two people with unequal position and power. And in this first interview, in which the rapport, the worker tries to build a rapport, a healthy relationship with the client, and the worker accepts the client as a person in a stressful situation, because with all the flaws and deficiencies and weaknesses the client is going through during this stressful situation, because the person who comes to the agency for seeking help is known as client, who is in a stressful situation and who is passing through a difficult condition of his and the environment of his life. In this first interview and the first meeting with the client, the caseworker tries to give full respect to the client and respect the client's personality and help him to resolve the client's issue. So the worth and dignity of client's personality is very important in the process of rapport building, which is known as the intake in the process, and the first stage in the process of social casework. So in this first phase of process of social casework, certain areas are probed, and in which first of all it is tried the stage of the problem, that at what stage the problem is existing with which the client has come to the agency. And number two, the nature of request and in relation to his problem. Sometimes the client comes to the agency with mentioning certain problem, but actually the real problem is something else. But according to the client, whatever he is describing and indicating the different problem, or maybe he is overwhelmed with the stressful situation and is unable to describe the real situation. So this is the major responsibility on the part of the caseworker, that whether he must examine that does the request relate directly to the needs and the problems of the client which he is describing, or whether the actual problem is something else. Then the caseworker tries to see the adjustment of the client to his social functioning in his job and with his family relationships. And it is also mandatory for the caseworker to analyze the physical and mental health of the caseworker. And simultaneously, it is also important for the caseworker to analyze the appearance of the client when he comes to the agency for seeking help in the first meeting, to assess the socio-economic conditions of the client and his psychological and physical health of the client. Then the number two step in the process of social casework, which is very important, is the psychosocial study. Psychosocial study is the initial assessment of client's current position, current situation, current circumstances, and the relevant information from the past, and the possible future mode of adaptation to stressful situation and normal living situations. So this is overall the assessment of the client's present scenario, the past situations, and the future course of action that can be adopted to solve the problem of the client. Perlman has discussed in detail the contents of casework study, and which includes the nature of the presented problem, that what kind of the problem the client is facing, what is the nature, the type of the problem is, and how much this problem is significant. Actually, whatever the client is describing, that this is the most important, the most significant problem, or whether the hidden problem is something else. So a caseworker should have the ability to clarify and to analyze the situation in a very comprehensive manner. Then it is important to judge and to identify the root causes of the problem, that which are the factors, which are the causes which are responsible for the creation of this sort of problem of the client. And then it is important to know for the caseworker that what kind of efforts have been made till the time the client has contacted with the caseworker or has come to the agency for seeking relief. What kind of efforts have been made to cope with the problem-solving process? So similarly, it is important to know that the nature of the solution, or the steps which have been adopted to seek help from the agency, what kind of the solution have been adopted till now, and what kind of the solution is needed for the resolution of the problem. And then it is important to know that whether the client has come and has been referred to the right agency, or the actual nature of the agency and the problem solving means in relation to the client and his problem. This is important, that a caseworker tries to find out the harmony between the client's problem and the nature of the agency, that what kind of the services the agency is rendering or providing, whether this is according to the problem of the client or not. The third one is the psychosocial diagnosis, in which the assessment is made. Perlman has mentioned in 1957 that diagnosis helps in determining the focus of treatment, further collection of facts, and deciding the best course of action to solve the problem. In psychosocial diagnosis, all the facts are seen, and it is determined that what kind of course of action and what kind of line of action is needed and can be the best for the solution of the problem for the client. Then diagnosis in context of psychosocial assessment is important. The diagnosis is concerned with understanding both the psychological or personality factors which bear a causal relation to the client's difficulty, and the social or environmental factors which tend to sustain it, that what kind of the psychological and the behavioral patterns of the client, and what kind of the social factors, the environmental factors which are also responsible for the existence of the problem, and which are adding in the existing issues and problems of the client. Then is the psychosocial diagnosis. Social diagnosis is the attempt to arrive at an exact definition as possible of the social situation and personality of a given client, which means the social diagnosis is concerned in which the caseworker tries to reach at the conclusion that this is the actual and the definite problem which can be solved. Because in the meetings, the caseworker and the client can describe the lot of other problems which doesn't have any relation with the actual problem. So the professional caseworker, in the light of his professional knowledge and using the certain techniques and approaches of his profession, tries to reach at the final decision in which the caseworker defines the actual problem and issue of the client in the light of the factors and in the light of the evidences and the discussion which the client provides to the caseworker. Now, if we talk about the contents of the social diagnosis, first of all, it is important the nature of the problem brought and the goal sought by the client in their relationship, which means that what kind of and what is the nature of the problem the client has brought to the agency, the client has described to the caseworker. And in the light of that, the caseworker has set the goals and the objectives after having the discussion sessions with the client, that now what will be the clear objective to be achieved for the betterment of the client and for the solution of the problem of the client. Secondly, nature of the person who bears the problem and who wants to seek the help and who is in need. So the nature of the the personality of the client, the types of the behavior patterns of the client, what kind of the behavior patterns, the morality system, the family background, and the attitudinal diversity the client has. In the light of that, the social diagnosis is made. Then the nature and purpose of the agency and the kind of help the agency is providing and the agency can offer, and what kind of the help can be sought from the agency. So it is important to know the nature of the problem and the nature and the type of the personality, client's personality, and the behavior patterns of the client, and simultaneously on the other side having the professional knowledge of the agency, that what kind of the services the agency can provide and can offer for the solution of the client's problem. Then it is important to shift the relevant data from the irrelevant stuff. It is important, and I think this is the most important skill on the part of the caseworker, that the caseworker should be capable to delete and to leave the irrelevant stuff from the information and from the all sharing discussions with the client and from the collected information about the client. So it is important to shift the relevant from the irrelevant data, from the irrelevant information, and then organize the effects and organize the facts and other important clues and arguments, and then try to get them into a relationship, which are related factors. This is another important skill which should be on the part of the caseworker, that the caseworker should be able to relate these gathered facts and this gathered data should be, and this data should be kept in harmony, so a clear picture can be seen with reference to the problem of the client. Then it is important for the caseworker grasping the way in which the factors fit together. That if it means that if something is belong to one direction, the other thing should be in the same sequence, in the same order. It is important that the caseworker should have the ability to relate certain factors, to relate certain important information regarding the client. And then why it is important, so the caseworker must have the ability to prepare the meaning of the whole picture of the scenario of the caseworker as a whole. Because in casework method, while using the intervention of casework, the caseworker tries to help the individual as a case-by-case approach, and tries to take the individual as a whole, as one unit. So it is important that total facts should be gathered, and there must be a sequence between the factors, between the evidences about the situation of the client, and a relationship should be built up between these facts, and a meaningful picture of the whole scenario of the client situation should be prepared by the caseworker. Then the fourth step is very important in the process of social casework, that is the intervention, in which the caseworker intervene practically and apply the intervention, the method of social work to solve the problem of the client. So this is important, and this is actually the treatment which is provided to the client, and it is intervention which is used in the problem-solving process. According to Hamilton, the treatment is the sum total of all activities and service directed towards helping an individual with a problem. And the focus is relieving of the immediate problem, and if feasible, modifies any basic difficulties which precipitated it, which exaggerate the situation, and this is important. In this method of social treatment, administration of concrete and practical services are provided. For example, if the client is in the need of financial assistance, so the money is provided or financial assistance is provided to the client. If the client is a patient and is in need of some medical assistance, then a proper medical care is provided to the client. And if the client is a student and is a deserving and a needy student, then scholarship is arranged for that student. And if the client is in need of some legal aid, then a social worker also works like an advocate and can do lobby for the provision of legal relief to the client, and speaks on the behalf of the client where the client can't speak for himself or herself. Then the second step is, this is what we talked about, the direct treatment. And sometimes indirect treatment is also important, in which the modification of environment is done, which means the change, the caseworker tries to bring a change in the environment of the client, and which can be both physical as well as the social. For example, like if the students while applying the intervention of school social work, if the student is lacking some educational efficiency and educational, the client is having some educational problem, the summer camps can be arranged for the students so they can fulfill their deficiency in education, in their educational program. Sometimes a client comes to the caseworker who is suffering from some sort of psychological problems, psychological disorders like lack of confidence. So the caseworker can use the group therapy and can conduct some group sessions with the client, and after having the group experience, the client can develop his or her confidence and can develop his personality, and group experience can play an important role in the personality development of the client. Sometimes the client comes to the caseworker for having some deficiency in some technical knowledge or technical skills, or the client having some sort of financial problems, and the client is very deserving. So the caseworker, with the help of the agency and with collaboration of other agency, can arrange and organize some training programs for the client. So the client's deficiency and incapacity of getting job can be fulfilled after having the training sessions and after attending the training programs.